Leukemia is cancer or abnormal growth of white blood cell. White blood cell is basically a component of human cells that is used to control infection. But in leukemia, the white blood cells just becomes dangerous and toxic to the human, to the children. In Malaysia, statistically, 1 in 1,000 children suffers from leukemia, and it is the most common cancer in children. For example, if we have 100 children with cancer in Malaysia, 75% of them suffers from leukemia. In general, leukemia can strike any children. There is no specific risk factor. But when we ask the parents if their child has leukemia, so the doctors should pay attention to the next child or to the younger children, because there are some risk of leukemia in the family. But that doesn't mean if one child has leukemia, the other child will certainly have the same illness. But unfortunately, there's no specific criteria to tell us that confirm this child will have leukemia, or definitely this child will have leukemia. It just goes at random and nobody really knows the cause. There are certainly warning signs to suggest a child is suffering from leukemia. The most common and often ignored symptoms is prolonged fever. Prolonged means every day, 24/7 fever. Let's say in that 14 days, if a child has fever for the first 4 days, recovered for 3-4 days, and the fever recurred, may not be leukemia. Leukemia means fever from day 1 until day 14 every day. And sometimes the fever does not subside with the antipyretic or anti-fever medication. So yes, we still diagnose a child when they have fever as infection, but if the fever keep on persisting despite frequent and regular antipyretic, anti-fever or antibiotic, then the parents should get worried. And the doctors, if they see a child with prolonged fever of more than 14 days, the doctors should also start the ball rolling in terms of investigating for leukemias. The other symptoms to suggest a child may have leukemias are bruising easily at abnormal areas. Yeah? For example, a child easily bruises at the shin, that's common, but bruises at the back and bruises at the fingers. Yeah? Second, common symptoms are easily bleed, meaning from the nose and from the gums. And number 3, loss of weight and loss of appetite. And number 4, the abdomen or the tummy becomes more prominent because of enlargement of liver and spleen. The other symptom that parents must think of leukemia when their children have enlarged lymph nodes. Lymph nodes are basically glands that you can feel, yeah, around below the chin, behind the ears, at the axilla, at the armpit. If it's large, more than 20 cent size, and feel rubbery like the dough, then parents must be alerted. Tell the doctors, your children have this and they need to be examined properly. Leukemia in children somehow has more unfavorable outcome if it happens compared to adults. First of all, the leukemia itself can cause death to the children, and number 2, the treatment itself can cause death to the children. However, children's leukemia are more responsive to treatment, providing treatment is given earlier, adequate, and completely treated. And the other difference between children and adults leukemia is that in children, we can opt for bone marrow transplant, meaning we replace the child's ill bone marrow, the bone marrow with lots of cancer cells, with a healthy bone marrow that will help in treating and eliminating leukemia from the child. The first thing that the parents needs to know about leukemia is to get a proper diagnosis, full stop. Yeah? Secondly, they must know that in Malaysia, fortunately, we are adequately knowledgeable in terms of treating leukemias. We have at least 4 centers which is certified worldwide to treat leukemias. The first place is in University Malaya Medical Center, and then HUKM, and then HUSM, and then of course in Ipoh, Kuching, Kota Kinabalu. So parents don't feel that they are alone. And I forgot to mention HKL as well. And we have certified and trained pediatric oncologists in these centers. And number two, there are cancer societies where the parents can get involved with, because it's a long journey. Cancer is a long treatment, and sometimes parents feel they're alone. They are by themselves, but they are not. I mean, the other parents has gone through the similar illnesses and they can probably help. But parents needs to know sometimes, no matter how much we do, cancer is a terminal illness and it may cause unfavorable outcome to the child. So yes, we prepare for the best, we have good treatment, but sometimes the child may just miss the child along the way. And don't feel that you're alone, don't feel there's no treatment in Malaysia. We have good treatment available, and we even have bone marrow transplant unit in Malaysia, and there are good doctors around to help.